Breast surgery is typically not very painful. Most of our patients take ibuprofen or Tylenol a couple days after surgery and keep an ice pack on it. If we can keep the swelling out of the area, they have very little discomfort. Now, this is true for core needle biopsies, for lumpectomies, and believe it or not, even for mastectomies. For biopsies and lumpectomies, they're typically done on an outpatient basis, which means you come in that day, you leave that day. The incision is usually as small as we can make it, and we put all of the stitches under the skin. They dissolve. Patients can usually shower the next day and go back to doing anything they want to the next day. They, of course, will go home the same day as their surgery. Mastectomies are a little bit different, though. People will stay in the hospital at least one night if they have only a mastectomy. Now, if there's no problems the next day, the patient feels like going home and we don't have any reservations, we allow them to do that. If they have reconstruction after their mastectomy, it can be different because those patients may stay in the hospital for up to 2 to 3 days. The challenges once a patient goes home for surgery, most of the time are very minimal. We allow patients to get back to their normal activities as soon as possible. Most of the time, even for mastectomies. We do restrict those patients a little bit more, however. After core needle biopsies and lumpectomies, we typically tell people not to have any trauma to the area, but they can shower the next day, they can go back to doing anything they want to except have trauma. If they keep ice pack on it and take ibuprofen, they probably will have very little discomfort and they'll feel like getting back into the normal activities. For mastectomy patients, they do have drains in, so of course these drains will slow them down, but as long as they put on a larger shirt than they usually do, they can go to town, they can get their hair done, they can go to church activities or anything else that they find important. After a mastectomy, some patients do have problems with their arm on the affected side, but typically it's because they sort of favor that side and don't move it as much. Now, we certainly don't like people to lift their arm above their shoulder. Down here, I allow my patients to do anything they want. Now, surgeons are different. Some surgeons put 1 drain, some surgeons put 2. I sort of put 2, which means that the first drain comes out on day 6 regardless of how much fluid it puts out. The remaining drain usually comes out when it puts out a very small amount for 2 days in a row. Now, this is something that can be done by the home health care team that takes care of the patient once they go home after mastectomy, or it's something that myself or my office staff can handle. Core biopsies, of course, the patient goes back to whatever they want to do the next day, and that's true of most people who have a lumpectomy. Anytime we do a mastectomy or we invade the lymph nodes under the arm, either to do a full axillary dissection where we take all the lymph nodes, or where we do a sentinel lymph node procedure, just taking 1 or 2 of the lymph nodes, we do kind of restrict people just a little bit more. We certainly don't want them to have any trauma to that area. We limit how much they do use their arm for the first week, but pending no problems, they get back into their daily lives very quickly.